Okay, so our other healthcare person, and I'm always interested in hearing just because I think it's really important. We had Susan Love here a couple of years ago, who's an uber famous breast surgeon who really put breast surgery on the map out in California, and she was diagnosed with leukemia a couple of years ago, or maybe 3 years ago, but she didn't start to come forth publicly and talk about her experience, which was amazing. Just the way she thought about it and the journey and how she felt like everyone's going to end up being a survivor of some sort. So as a physician, it was really important to hear that. Okay, I want to introduce to you Brittany Guerrini. So Brittany also, works here at NYU. She was 26, but diagnosed. She is 26, and you were diagnosed when you were 4 years old with a stage 3 Wilms tumor, which is a pediatric cancer of the kidney. And you are currently a pediatric heme-onc bone marrow transplant nurse working full-time at NYU's outpatient ped heme oncology clinic, and you also work per diem at Memorial Sloan Kettering at the urgent care unit and the pediatric ICU, the intensive care unit. You worked 3 years as an inpatient heme-onc bone marrow nurse. That's hard to say, heme-onc bone marrow nurse. It's like just flows off your mouth. At the Cone Children's Medical Center. And ever since you were diagnosed, you always knew that you wanted to be a nurse. Becoming a peds heme-onc nurse was just that much better. You live in New York. You're hoping to get back to school to do your master's in nursing education so you can eventually teach new nurses. Brittany, come on down. And it's also really nice to meet new people. So thank you.
Thank you. Thanks for having me. So like Dr. Axelrod said, I was 4 when I was diagnosed with Wilms tumor. A lot I don't really remember. A lot I've actually just, my parents have told me throughout the years. But apparently I was peeing blood, so to speak. And so there was, my mom brought me in, and I think we were at the emergency room on Hempstead Turnpike, Nassau University Medical Center. And right away they had felt a lump in my abdomen, and they sent me over to Cohen Children's Medical Center, which I actually ended up working there like 20 years later. So I got surgery. I only have one kidney. I had my left kidney removed. I just have my right, and I went through 15 months of chemotherapy and 5 rounds of radiation. During my treatment, I actually ended up getting scar adhesions twice, which they said was like a very rare thing. The first time, they didn't know what was wrong with me. I just kept like throwing up, got like severely dehydrated. I ended up actually almost losing my life that night because I didn't know what was wrong with me. I had to just be taken in for surgery. And then after that, it happened again, which they were like, their minds were blown because they said this never happens. So I have like 2 big scars on my stomach, and then I have my Metaport scar where I got my chemo. I don't ever remember getting chemo. That's like I don't remember going to clinic. I remember like certain things. Like I remember there being like a clown and going to the playroom, but nothing like ever getting chemo or blood and stuff like that. So then I went for checkups up until I was 15 years old. It would be like, at first every 3 months, every 6 months, every year. And then when I was 15, I was done. And I was cancer-free. And then I always knew I wanted to be a nurse. My mom has a video of me when I was like 6, like after everything in the pool. And she's like, Brittany, what do you want to be when you grow up? And I'm like, I want to be a nurse. So then it was like right away after high school, I just went to Malloy on Long Island. And I was 21, and I graduated. My friend was working at Cohen's, and it was just coincidence. She just had messaged me, and she was like, oh, do you want a job at Cohen Children's Medical Center? And I'm like, well, yeah, I'll take anything I can get. I just graduated, of course. She's like, okay, let me set you up with a nurse recruiter. And I was talking with the nurse recruiter, and actually I was interviewing for a job with the PICU, the pediatric ICU over there. But she had asked me, she was like, oh, like, what are your other interests? And I'm like, well, I actually really would like to do pediatric hematology oncology. She's like, I think there's an opening. Let me set you up with the manager. So I got set up with the manager, and I sat down with her in her office. She opened up my resume, and she was like, your name is so familiar to me. And I'm like, well, I had told her my story. She's like, I remember you, blah, blah, blah. And I'm like, it was crazy, So then she ended up offering me the job a couple weeks later. So then I was working on that floor. I did for 3 years on that floor, inpatient, hematology, oncology, bone marrow transplant. And then it was a night job. I couldn't really do nights anymore. And then I got a job at Hassenfeld Children's Center in the outpatient pediatric hemonc, which it's a wonderful place. So now I'm, giving chemo every day to these kids and whatnot. And then my friend asked me, she's like, do you want to do per diem at Memorial Sloan Kettering? Of course, So then I go up there about 3 Saturdays or Sundays a month, and I go work in their pediatric urgent care or their pediatric ICU. I guess that's my story. I mean, I kind of, I don't know what my long-term side effects, besides the fact that I do have like some PTSD, like I always think that I'm sick. Like if I have a headache, it's a brain tumor, if it's like the worst thing ever. Like one time I ended up in the emergency room because my stomach hurt, so I like diagnosed myself with diverticulitis. I went to the emergency room and they're like, we can't find anything that's wrong with you. I mean, we can run more tests, but I mean, so that's kind of my problem now. They did tell me to like avoid contact sports because I only have one kidney, but I played rugby in college, so I kind of did that too. I guess I always just wanted to defy the odds a little bit. I always like to like live my life to the fullest. I completely 100% like live my life in that way. Because, you never know. That's it. Thank you.
Wait a second. Where are you going? Wait, I want to just ask you a question. When you deal with the families, do you tell them that you're a survivor?
It depends on the family. Some families I get so close with. And if I feel it's like, it's appropriate, like I'm, sometimes if they're getting, depends on the diagnosis also that the kids have. But it's funny that you say that. One of these kids, oh God, I love him. He's so, and his mom I'm really close with. I was telling her we were doing a survivor dinner actually on Tuesday for kids who have survived at Hassenfeld and NYU. And I'm speaking actually there too, sorry. So I'm like, they're like, oh, can you like invite people? I'm like, yeah, sure. So, I'm telling people and.
You still do the boat ride? You still do the boat ride?
No, it's at River Park. Yeah. So I was telling one of my kids and then his mom, and he was a little difficult at first. Like he wasn't really opening up, but he's starting to open up a little bit more. So I was just I'm like, I would really love if you guys came. And then I was telling her my story, and she like started crying, and she's like, I'm so happy that that he had heard that. That really like will just make him like so much, and that like kind of touches me a little bit that I'm able to do that. So I'll pick and choose like who I kind of talk to, based on like what they have and like how close I am with them. But not everybody. I mean, everyone I work with pretty much knows, but not all of the. But I think it's kind of helps me to like connect with them in a different kind of way.
Sure. What parent wouldn't want to hear that?
Yeah.
That a similar cancer that you
Right.
survived to become a beautiful young woman.
Thank you. Yeah, it's nice. As I like to tell them like there is light at the end of the tunnel. I know you feel like you're going through this, and everything's kind of in one ear out the other. But sometimes I like to tell them, when they're like in it more and they're understanding more, that there is an end. Yeah.
I remember that I had a patient that went for an augmentation, which is to get implants. And during the exam, they found a cancer. And it should have been very straightforward, but the cancer turned out to be in the breast, a triple-negative breast cancer. She needed chemotherapy. But on top of that, her mother I had treated also had breast cancer. So we decided, let's just do a BRCA test. And her BRCA test at the time turned out to be positive. So everything was cascading. Now at the same time, so now she had her surgery. This is before we were giving a lot of neoadjuvant chemo, the chemo first. She was on chemotherapy, and she's a tough broad. I mean, she was doing okay, but in the middle of her chemotherapy, her daughter, 4 years old, got diagnosed with a stage 3 Wilms tumor. Like an unbelievable situation.
Yeah.
The BRCA turned out to be from her dad, who didn't know it. Then her other unaffected sister had a BRCA. She ended up having preventive surgery. Another sister had terrible survivor guilt because she was, BRCA negative, meaning she didn't have the mutation. So, and the girl, the young girl's now in college. It just, and she initially, when she was young, she went to a camp for young kids with cancer. It was beautiful.
Yeah, we have a couple of them actually. They're starting up now in the summer. It's nice.
But this was maybe 15 years ago, so it wasn't that well known.
Right, and now like everything's like changing. Chemo's getting chemo's all different, and I don't know how much Wilms has actually changed so much, but like it's unbelievable like how many kids actually do survive and like do like thrive and do great. Everyone always tells me like, I don't know how you can do that, how you can be a nurse, like that must be so sad. And it's like, it's really not. It's really actually unbelievable to see how well these kids do. And
but it's like such it could be such a ripple effect. Having not only just you having cancer, but just everyone.
We have actually a lot of those stories. It's like for some families, like when it rains, it pours, and one kid and then the other kid is in a car accident. It's like we get these crazy stories about like how they're diagnosed, and it's like, oh my God, like what can you do? It's like terrible. But
well, you can be a good conversational person when you're giving chemo.
Yeah, but I'm hanging it.
Thank you.
Yeah, thank you.